Let's talk now to Abdullah Sabia, who's the CEO of Rightangled, which is a testing provider producing coronavirus testing kits. Abdullah, very good morning to you. Thank you for joining us.
Good morning, Mike. Thank you very much for having me.
It's obviously a very, very complicated area, this. You know, we've been talking about testing kits and testing for quite a long time. A lot of people getting very worked up about why the government's not doing enough testing. But it seems to me that, you know, lots of these tests are quite complex and may give lots of very different outcomes.
Absolutely. I think before we start, I think it's very important to highlight there are two types of tests that are currently available. The antibody tests, which are called the immunoassays, and these are the ones that the government is currently testing their accuracy and their specificity before approving them and having them deployed on a mass scale for the population to test themselves.
Right.
And these are the ones that test whether or not you've had the infection before, and they can give you a quick reading within 15 minutes. The other type of test, which is the gold standard for all healthcare providers worldwide that they use, is a lab-based, and it's called it's based on qPCR type of testing. And these are the tests that currently test the genetic material within the virus to see whether or not it's present on a swab, on a throat swab, or on any kind of sample that would be collected from the patient.
Okay. So a lab-based test is the one that has to be sent away and takes maybe 2 days to come back?
Exactly, that's the one.
Okay. And what about the things that are being done? For example, I was watching a report from China. One of the Sky TV crews went into China and people are being tested. They're being sort of swabbed as they go into the country before they're allowed to go any further. What kind of testing is that?
This is a swab-based test. So anything that involves a swab is a lab-based. It's collect a sample from the person and it's sent to the lab for analysis. And that's when the patients are then followed up with their results.
Okay, and assuming you'd be right, you would agree with Matt Hancock, who says, you know, the bad test is worse than no test.
Absolutely. And I think what he's referring to here is the immunoassays. These are the ones that we haven't really yet been able to determine their accuracy and their specificity, and hence why the delay in releasing them on a mass scale is something that we're currently seeing. However, from my personal point of view, I think what we should be focusing on, and that's something that was also discussed in the conference yesterday, is the resources should be channeled towards lab-based testing, because these are the ones that can tell you whether or not these individuals are able to transmit the disease at this point of time. This is how we can control the pandemic. If we can pinpoint these people and detect the ones that are able to transmit these viruses, then we can better control the pandemic.
Yes.
By having them in quarantine, basically.
Now, we spoke to a medical professional, I think the day before yesterday, or possibly yesterday, I can't remember, all the days roll into one another at the moment, but he basically said that the test which finds out whether or not you've had it has a kind of 28-day lag factor, which means that, in a way, yes, the result is accurate at one particular time, but it may not be accurate straight after the test has been done. Exactly, and that's one of the biggest limitations for these tests. Yeah, it can give you an idea whether or not you've had the infection, given that the lag time has passed. However, it does not necessarily tell you whether or not you currently have it. So let's say someone that is asymptomatic, and there's quite a burden as well for national healthcare services across the world to really be able to see if the person who's testing positive is testing positive is currently having that virus. So one of the things that was discussed is giving immunity certificates to people who have tested positive, let's say. But is that enough to tell us whether or not the person is still able to transmit the disease? I don't think so. Well, that's the problem, isn't it? Because if we want to use these to try and at least make sure that NHS frontline workers can go back to work, that's not really reliable enough, is it? No, it's not. It's not. Lab-based testing must be delivered to them, and that's the kind of pressure that the NHS is currently having. Right. So this idea that we were talking about maybe 2 or 3 weeks ago of having home testing kits that could be sent to people, is that pretty much busted out of the water now? So home-based testing is a very general concept, and that's what we do at Rightangled. What we do is that we deliver these kits to people's homes so they can self-swab. So they can collect their swabs at home and send them off directly to the lab in a prepaid envelope without having to jeopardize the lives of anyone on their way to the clinic to get their samples collected or anything. Okay. The results are then analyzed by the lab. The samples are analyzed by the lab, and the results are delivered to the person online as well. And they can also have the access to the healthcare professionals to discuss it further.
And if, for example, I mean, I'm not sure there's lots of issues around all of this, isn't there? Because there's ethical questions as well. I mean, if, for example, you get a positive test from somebody and you send it back to them, are you then required to inform the authorities?
Absolutely. And we are currently having that process in place.
So that's already there?
Yes, absolutely.
Okay. And what about the capacity under which you could operate? You know, if you are given the green light, and we'll talk about whether you expect to get that anytime soon. If you're given a green light, say tomorrow, how many tests could you actually physically handle?
So what we do is that we offer lab-based testing. So the tests and the assays that we use have already have gone through the clinical evaluation, the performance for their clinical. They were evaluated for their clinical performance by Public Health England.
Right.
So they have been confirmed to have 98% accuracy in their results.
Okay.
And we currently have the service available for people to purchase it online, and we're also offering it to a lot of other healthcare providers in the private sector. We have also been receiving orders from NHS frontliners, given that there is a pressure on these assays delivered to them. And what we have opted to do is that we're currently subsidizing the cost for them and recovering these costs from our individual sales.
Okay. And so the test that you do determines what? Determines whether you've had it or determines whether you've got it?
You've got it. It's a lab-based. So what we do is lab-based testing.
Right. So if I have had it, but I currently do not have it, what would it show?
Negative results. We can't detect that.
Right. So that's not really any good to me, is it? Because it doesn't mean. So all I know is I don't have it now.
Exactly. So that's the kind of thing. It could give you that peace of mind whether or not you are capable of transmitting that condition or anyone contracting it from you. So if someone who have the symptoms or suspect that they might have the virus, the test would be able to tell them whether or not they have it at the time of the sample collection.
But that's what I mean. So I could have given you the test, I could have sent it off to you, and the next day I could have contracted the virus.
Yeah.
That's the problem, isn't it? I mean, that's where the problem lies here. And I'm not having a go at you at all, Abdullah. Don't get me wrong. All I'm saying is that the testing that people keep talking about, like even the World Health Organization, test. It's all very well, but it's only of a particular moment, isn't it?
Exactly. So that we are going through a pandemic at the moment.
Yeah.
It's not something that we are expecting to keep having for the long period of time. So if we were to control the pandemic, then we would need to be able to pinpoint exactly who are the people that are able to transmit it, so we can have them in quarantine and we can help stop the spread of that virus.
Yes. So I mean, it seems to me, and correct me if I'm wrong, because I'm not a medical specialist at all, it seems to me that this would be something useful for people who think that they've got it, i.e. who are showing symptoms of the coronavirus and who would like to know if they've got it.
Exactly.
Okay. So that would be useful. So how soon could you start to do that?
We have launched a service last week, and we are currently working at full capacity. We are enduring to fulfill all the orders that are coming through our way, and we have also offered the service to the NHS. So we are currently in contact with the NHS England and improvements team, to the COVID-19 triage team, and they are requested some details about our home-based testing, which is the service that we deliver the testing kits with. To see how we can really diffuse it within the.
So at the moment, in the absence of the NHS buying into this yet, you offer this privately. How much does it cost?
$199.
$199. That seems very cheap. I'll give you £2. So it's £200 basically.
Exactly. Yeah.
Okay. And is it covered by any type of insurance, perhaps? If people have insurance?
At the moment, medical insurance companies do not cover these tests.
Okay.
We hope that we would see that more prevalent in the foreseeable future.
Okay. Fascinating stuff. Well, listen, Abdullah, I really appreciate you talking to us, because it's cleared up a lot of things for me personally, I think. And people can, if they wish, contact you through your website, I presume, Rightangled?
Yes, rightangled.co.
Okay, thank you very much indeed. Abdullah Sabia there.